Hi, I'm Danielle Dick, and I am here with Jill Rabinowitz, who is the newest member of the Rutgers Addiction Research Center. We are delighted to have Jill, who's joining us as a new faculty member September 1st. She was previously on the faculty at Johns Hopkins. So welcome, Jill. We are so excited to have you as part of the RARC.
Thank you so much, Danielle. I'm thrilled to be here and share with you a little bit about my work.
Great. So let's start there. Tell everyone about your program of research.
So I am a child and adolescent developmental psychologist by training, and a lot of my sort of early work focused on temperament or individual differences in reactivity and self-regulation and how that sort of confers risk for psychopathology. And I was also very interested, again, this is more early on in my career, is sort of the role of context, such as parenting and neighborhood influences in influencing sort of temperament psychopathology relationships. And then as a postdoc, I became sort of very interested in sort of genetic underpinnings of temperament. And that sort of is how I got into psychiatric and behavioral genetics, which is a core focus of my research now. I'm specifically interested in how genetic risk for psychopathology is associated with substance use disorder treatment outcomes. And a lot of my work actually spans the developmental course. So currently, I received an R01 focused on associations of adverse childhood experiences and environments in relation to delayed discounting and substance use, and that's specifically focused on childhood and adolescence. In addition, I have other projects that are focused more on associations of substance use with aging-related outcomes, such as the role of substance use in predicting cognitive impairment, dementia, as well as Alzheimer's disease.
Great. So you mentioned delayed discounting. I know that you do a lot of work in that area. For those that might not be as familiar with that term, do you want to talk a little bit about what delayed discounting is and how it relates to substance use outcomes?
Absolutely. So delayed discounting refers to one's preference for shorter, immediate rewards over larger, longer-term rewards. And we generally know that greater delayed discounting is associated with early substance use initiation, greater frequency of substance use during adolescence, and in general, increased risk for substance use disorder development later in life. And so this is why I became very interested in this phenotype, particularly during adolescence, which is when delayed discounting tendencies are sort of developing and becoming more stable. And I've also been interested in assessing delayed discounting among adults, specifically in the context of substance use disorder treatment. And so my colleagues and I, specifically Brian Mayer and Gregory Kirk, we developed this novel EMA-based delayed discounting. Essentially, it's an app, but it involves assessing delayed discounting multiple times a day through essentially these questions that instead of having multiple choice options, you're allowed to select the amount of time or the amount of money that you'd prefer in a given sort of delay discounting in a given context. And so we're now piloting this delay discounting app in a local sample that essentially has a history of injection drug use.
So you mentioned one of your R01s earlier. I know that you are coming to us with a whole series of different grants and funded projects. So do you want to give kind of an overview of some of those lines of work that you haven't already touched on?
Absolutely. So as I mentioned to you before, we received a just-in-time for a grant that I'm super excited about, which is essentially an in-depth, an in-depth sleep study where we're assessing actigraphic sleep as well as sleep disordered breathing, in addition to circadian rest activity rhythms. And this study is going to take place in a substance use disorder treatment center. We're specifically looking at the sleep and circadian metrics in relation to opioid use disorder treatment outcomes. And we're also sort of looking at the role of positive and negative affect over time that may influence these associations between sleep, circadian rhythmicity, as well as opioid use disorder outcomes. So I'm super excited about that project. In terms of other grants, one grant is sort of focused on the association between sleep and its association with cognitive decline and how physical health comorbidities like type 2 diabetes might affect those associations. Another grant I'm focused on involves the ALIVE study. It's the AIDS linked to the intravenous experience study. And in that study, we're looking at the associations of polygenic risk for delayed discounting, as well as other substance use disorders in relation to injection drug use and other sort of health outcomes like ART adherence in that population.
Great. Well, we are excited to have you bring all of that expertise to Rutgers. And I know that one of the things that we have talked about is your interest in building new collaborations and projects with folks once you join Rutgers. So do you want to tell the community a little bit about what are you most excited about with coming to Rutgers and connections that you hope to make here?
Sure. So I'm most excited about sort of building and promoting this precision medicine initiative that Rutgers already has, right? And that's one of the things that really attracted me to Rutgers to begin with. A lot of my work already is sort of focused on precision medicine. I do a lot of work at local treatment centers, specifically at Ashley Addiction Treatment, where we have implemented sort of weekly and monthly tracking systems that assess mental health, sleep, stress, and craving. And I sort of look forward to similarly building a similar infrastructure that not only assesses those different phenotypes, but where we're also collecting sort of biometrics, including sleep, heart rate variability, and circadian rest activity rhythms that are sort of less studied in the context of addiction. So I'm really looking forward to sort of building the infrastructure of these treatment centers with the goal of really moving towards the realization of actual precision medicine. And I feel like we've been moving there for a very long period of time, but I'm really looking forward to actually being able to make a difference in substance use disorder treatment settings.
Yes, one of the things that I know you're already a part of that we're really excited about for this coming year is the center grant pilot funds we got from the Brain Health Institute and the Chancellor. So thank you to those folks out there, where we're going to be bringing together our expertise in genetics, in neuroimaging, in digital phenotyping, some of the kinds of things you were talking about earlier, as well as in neuroscience and animal studies, to think about how can we all come together to be looking at, precision medicine for substance use disorders. So why people respond differently and trying to better understand what works best for whom, or, as we sometimes say, the right treatment to the right person at the right time.
Exactly.
And I think that the RARC is really a great place for that, because we have this huge diversity of addiction researchers in terms of, background and expertise, but we also have such nice connections to our clinical partners. And so one of the things that we're really working on building this year is what we're calling the Research Community Partnership. And so the idea being, when you get treatment at Rutgers Health, and for example, working with our partners at UBHC, University Behavioral Healthcare, as well as through Robert Wood Johnson Barnabas Health, essentially looking at when you're coming in and you're getting substance use related treatment or care, you are connected to this amazing community of world-class researchers. And so how can we create a community of individuals who all want to advance the science, who want to make things better? And so that's one of the things I'm most excited about for this coming year as we're building that program with our clinical partners, and really excited to have you as a part of that.
Yeah, I'm excited about being a part of that as well.
So, Jill, you're an early career researcher in a sense, though rapidly kind of moving toward mid-career. But we have a variety of trainees at different levels who are affiliated with the RARC. And I always ask faculty, as someone who is closer to the experience of being a trainee than I am at these days, what is your advice for early career faculty and really finding tenure track positions and getting on that academic career path?
Sure. So I would say the number one thing that I think can contribute to your success is persistence. I don't necessarily think it's how intelligent you are. I mean, certainly that plays a role, but being tenacious and understanding that this is academia's. It's not an easy career path. It's not. You will write manuscripts and sometimes reviewers will say this is the best. Well, they typically don't say this actually, but they'll say, this is, really wonderful work, really will move the field forward. But then you will get other reviewers that don't necessarily think that way. And I think being resilient in the face of criticism is really going to be instrumental in terms of you going through academia, progressing through academia. What was the other part of the question?
So that's a great, I love that piece of advice for early career researchers. And the other part was really just, for other individuals who are looking at getting academic tenure track positions, what was your kind of path toward that?
Sure. Well, I will say, I think it depends on the type of academic position you're interested in. I was on the job market several years ago, and I had a number of publications. I had teaching experience. And the universities I was applying to were mostly R1 universities. And at the time, I did not have a history of external funding. And the feedback I was getting was like, you're so productive in terms of writing manuscripts and getting published. And you have this sort of longstanding history of teaching, but we don't see a history of you basically getting grants. And so going back to the idea of persistence, I was like, okay, I'm going to write grants, and I'm going to partner also with senior faculty who have more expertise than who had more expertise at the time than I did, to sort of put myself in a position where the likelihood of me getting grants is just greater. And so I will say, if you're interested in more of a research R1 type university, I would say it's really important to sort of prioritize grant writing and getting experience in that realm. However, if you're more interested in a university that might be an R2 university or one that's more teaching focused, I would say that that's probably maybe a little bit less relevant, and I would focus more on manuscript writing, mentoring students, and as well as teaching. So I think the advice in terms of like progressing through one's academic career and what to prioritize depends on essentially what kind of university you'd like to pursue, and where you see yourself.
I think that's amazing advice. And I also love that you shared that when you first were looking around, you didn't all get universally positive experience, right? It wasn't like you essentially sent out some applications and immediately had your tenure track position. And I think that's one of the things that, more of us are trying to talk about, in the sense of, yes, sometimes you only see the wins out there, but there's a history of fails that you learn from along the way. And that's certainly been my experience as well, too. I try and post on Twitter whenever I have grants that don't get scored and don't get reviewed as well. So people don't just look and go, well, gosh, this person has all of these grants. How do you do that? It's like, well, I write a lot of grants. And so a lot of them get scored and funded, but a lot of them, maybe even more of them.
Yes, exactly.
So to your tenacity point, someone once said to me, the key to surviving in academia is to internalize your successes. So when you get that really positive feedback, you go, yes, I am a really great scientist. And when you, and to externalize the negative feedback that you get. So when they say like, oh, this paper isn't any good, or why did you do things in this way? This idea isn't going anywhere, that you go, oh, well, that was just a grumpy reviewer having a bad day. So I have found that that's very helpful for my own mental health moving through academia.
The other thing I would say that I found very helpful in my career is humility and understanding when you don't know something and being okay with reaching out to other people who do, right? I think that that's been one area that's essentially why I've acquired a lot of the knowledge and skills that I have is recognizing, look, this is something that I don't know. I'm really excited to learn it. I'm going to reach out to people who have greater expertise in this area. And I will also say, speaking to what you were just saying about sort of externalizing the feedback, especially the negative feedback, I would say that totally makes sense. Sometimes, though, you get really great feedback it's constructive criticism, right? And there have been times where a reviewer has pointed something out. I'm like, oh my God, that's brilliant, right? Like, oh, I can't believe I didn't think about that. And it might be in the context of getting a paper rejected, right? Or like a grant not getting scored or not doing well. So I think it's important to also take that into account, right? That, like, you know, people might have different perspectives than you do. First, they might have greater expertise or different expertise than you do. And it's okay to reach out to those people without that knowledge. And also being open to constructive feedback, even if it's not necessary, even if you didn't necessarily have that information, or it's received in sort of a negative context where, again, there's like a paper rejection or grant didn't do well. Sort of being open to that feedback, I think, is really important.
Well, Jill, we are so excited to have you join us at the RARC. We're fortunate, clearly, as evidenced by the way you approach science and the field, to have you joining us. And folks who are out there, Jill is the newest member of the RARC. I know she's looking to meet individuals and make collaborations, and so feel free to reach out to her. We will circulate her new contact information, and you can find her at addiction.rutgers.edu on the RARC homepage. So welcome, Jill.
Thank you.